Hello, 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 everyone. Welcome to another episode of Sree's daily global COVID-19 show. My name is Sreenivasan, and I'm the Marshall Loeb Visiting Professor of Digital Innovation at Stony Brook School of Journalism. It is my honor to convene this daily global conversation around all aspects of COVID-19. We do try to not focus on the news, but on aspects that you may not see covered every day on television or on the radio or on the internet. And we want to hear from you. We are live right now on Facebook, on Twitter, on YouTube, and on LinkedIn. The way to find the archives of everything we do is to find us and go to our YouTube account and look at SreeNet is my YouTube account, and you can find our entire archive there. Today we have a very special show, and we want to tell you all about it. We're calling it Nurses Are Heroes, and we have both a hospital administrator and a nurse with us. And our nurse is Elyse Isopo. She's on Instagram. Please follow her, Elyse_Isopo. She's a critical care nurse practitioner at North Shore University Hospital. And we've been spending some time together, and you are really going to enjoy getting to know her. We're also joined by Terry Lynam. He is at Northwell News on Twitter. He's Senior VP and Chief Public Relations Officer at Northwell Health. So stay tuned for that conversation with them. Please ask questions. Tell us where you're watching from, because I know Elyse and Terry would love to see the global nature of this conversation and people watching from everywhere. So tell us where you're watching from and any questions you have for our nurse guest. And before we start, we always need to pay the bills. So we want to thank our sponsors. And our first sponsor is SownSocialMediaSolutions.com and the Survive with Live Video Bootcamp. It starts June 1, and you can learn how you can launch your own consistent live stream show in just 8 weeks. Sign up today at SownSocialMediaSolutions.com, SOHN SocialMediaSolutions.com. Big thanks to Tim Sohn, who was our very first advertiser when we started the show 71 days ago. And now he's come back and he's advertising with us again. We're very grateful. If any of you would like to advertise, please email me, Sree@Sree.net. You see my email address right on the screen, and we'd love to help you get your message out to the world. We're also sponsored by Muckrack Academy. I happen to be teaching this particular course, Fundamentals of Social Media, for journalists, PR pros, and everyone. It starts in June. Free certification course. Save your seat at mrac.co/social. mrac.co/social. You can go right now and sign up, and it's open to people of all backgrounds, all experience levels, all ages, and all interests with social media. So mrac.co/social. And the reason we decided to launch that course in the middle of this pandemic is with the jobless situation, with the economic meltdown, there are so many people who need to have a baseline understanding of social media and have been asking me for years, do you have a basics course? And I've had various versions over the years, but this is the definitive Fundamentals of Social Media course that we've put together, my colleague Linda Bernstein and I, and we want everybody to be able to take it. We've had more than 3,000 signups already, and you can sign up today. It's open, mrac.co/social. It's about a 2-hour course. You don't have to take it all at once, but we'd love to have you take it. All right, I think we're ready now for our guests. We want you to give a big, big welcome to our guests. Our guests are Elyse Isopo and Terry Lynam. Let me bring them on. Hello.
Hi there.
Hi.
How are you doing?
Great. How are you?
Doing great. Pleasure to be with you today.
Thank you for both of you for being here. One of the things I always start with when we do our show is ask each of our guests, how are you doing? How's your family? And tell us where you are. So we'll start with Elyse.
I'm doing good. Things are definitely getting better. I'm actually home right now. Usually on Thursdays, I've been trying now that things are settling down a little bit to take at least 1 or 2 days a week off. I do work 13-hour shifts, so 1 to 2 days a week is usually not enough, but we've been doing great and things are definitely getting better that I'm able to take that day off. So I'm home right now. My family's doing, thank God, very well. People in my family are getting better from the COVID-19. So things are getting definitely better. Thank you.
Thank you. And let's go to Terry. Hi, Terry, and tell us where you are and situate, the places you both work for us, because we have people watching from around the world.
Sure. So I'm in Northwell's corporate headquarters, which is in New Hyde Park. Elyse is about 1.5 miles away at North Shore University Hospital. I have been coming to the office every day for the past 2.5 months. The good thing is I live in New Jersey and I have a 65-mile commute every day. And the only good thing about this pandemic is traffic has been almost non-existent. So I can actually get here in about an hour flat. So that's been good. But my family's good. I've been feeling good. So again, this has been it's been a crazy experience, but very very challenging, obviously. But from a PR perspective, it's been very rewarding to kind of chronicle these experiences.
Absolutely, and we want to make it clear, you're talking about Long Island is where you are. It's many miles from New York City, but it's all part of that greater New York City area. And it's quite a feat that you are driving from New Jersey all the way to Long Island. That's pretty amazing.
Over 2 bridges. I've been doing that. I've been doing that for 19 years, so I've become numb to that commute.
Yeah, I'm just trying to think of how difficult that is, and so let's do what I call a global tour, folks. I will show you where people are checking in from. They're coming in here and saying hello. This is Dr. Kanika Manga is watching, and she's watching in Houston. She was a guest on the show this week, and she says nurses are heroes. Ashok is watching from the state of Kerala in India. Hello, Ashok, and everyone, please keep telling us where you're watching from. Please connect. Adept says hello. He says hola, actually. And Sai says, hey, everybody. And so many different folks are watching. We're just so grateful. Ashok says, welcome guests. And we love seeing this kind of global nature of this. Nandini is watching from Toronto. And welcome, Nandini. Thank you for being here. And look at the number of thumbs ups that James has given us. I think this might be a record, and with exclamation points. I also want to make sure that both of you, Terry and Elyse, have had a chance to share this with your networks as well, so that all your family and friends are able to join us. And Marco says Terry is the ultimate PR pro. Our friend Marco Greenberg, who's been on this show as well, and Marco is terrific, and so cool to have him here. Sai is watching from Hyderabad in India. Chester Lee is watching from Brooklyn in New York. So let's get to it. Thank you all for watching. Please tell us where you're watching from, and please ask our hero nurse, our Elyse, a question. But let me go to you, Elyse. You are, just to be clear, where are you? I understand you're in your husband's man cave. Is that true?
So that's correct. Usually not allowed up here, but for this, the kids are downstairs and trying to keep it quiet. So I'm in my husband's man cave. So everything you see around me is my husband's, including the picture behind me of horses. He's a big horse race fan, and there's fight pictures up here. He likes to watch fights. But this horse race actually is, we're from Little Neck, and the horse's name was Little Neck, and it won a lot of money. So that's a famous picture that he loves, and that's what he does up here. So that's where I am.
Yeah, I love that. And we should point out again, we have this global audience. Little Neck is a part of Long Island. That's the name. There's also Great Neck and Little Neck in Long Island. These are all new things for many of our people watching, though. Yeah. I see my friend Nick Balaban is watching from Brooklyn. He knows what we're talking about here.
Absolutely.
And Tapadir is watching from Tripura in India, in Northeast India. And Redan is watching from Center Reach, New York. So we're really covering the world here. And he says, love, love, love for all nurses and nurse practitioners. My late mother, who died of COVID-19 on April 27th, has been an RN for 50 years, primarily in the operating room. She retired in 2007. As well, many of my mother's Filipino side of the family were nurses. If I may just take a second here and talk to her. I'm so sorry to hear about your mom's passing of COVID-19, we're, our condolences and our hearts go out to you and to everyone who's watching, who's had someone who's been affected or has lost someone. This is such a difficult time, and we want to point out that nurses like Elyse are often now, tragically, the last people that our loved ones get to talk to, because everyone else is using FaceTime to connect. And so that has added to the tragedy here. And so the nurses aren't just the folks who take care of us, but in many cases, they're also the ones who take care of our families as they're saying goodbye. And even as I say that, my voice is cracking. Elyse, can you reflect on that? And thank you again for everything you do. And
thank you. And I'm sorry for your loss. Terrible. And thank you for your mother's service for all those years. So we are seeing a great amount of loss, and it's terrible. And being a critical care nurse, I thought I was used to death and loss, but nothing at this extreme. It's tragic. There's family members that aren't able to be there throughout the trajectory of the dying process, but know that we are there and we're fully there. Our heart, our soul, everything that we do is with your loved ones. In our practice, we are letting people come in, 2 people at a time for a very short amount of time, like 30 minutes, to say goodbye if somebody is actively dying, because they need to be there for themselves as well as their loved one and family member. So we are bringing people in with the risk of, the COVID-19 is a very transmitted virus. So we do give them gowns and gloves to try to protect themselves, but we only limit the time into 2 people. Just know that we are holding people's hands. We are playing songs. I feel that we're getting great bonds with families, even though it's through phone calls, but you have to make that bond in order to connect with the family and the loved one. We're finding out information about patients. They're sending us pictures of them. We're posting them around the room. We read the patient's story. And so we connect with them that way, via FaceTime with the family, but also through conversations. And I've made so many bonds, and I have so many Facebook and Instagram friends of family members that we either saved or we lost. And when we lose people, we try to make that dying process as peaceful and loved as possible, holding hands.
Thank you so much, Elyse. I'm just listening to this pains me, but also inspires me with the work that you do and the service and love that you have. Let me ask Terry, who has been watching all of this unfold. You've been in the business a long time. How are you at the hospital level working with your nurses and preparing them for these moments? In their careers, they've done versions of this, of course, but the speed and volume that's going on, Terry, talk us through that, please.
So we've gotten a lot so I oversee public relations for Northwell, and we've gotten a lot of requests from news media across the country, even around the world, to try to connect with our caregivers on the front lines to get a sense about what is going on, what are they experiencing. And what I've found that's quite different this time is the willingness of our caregivers like Elyse to share their experiences. So we've had Elyse and probably several dozen others were involved in producing video diaries that kind of chronicled what was happening. They would speak. They would have their phones on the unit with them, and would provide these snippets of information about what they are seeing. They would have short interviews with their colleagues, obviously protecting patient privacy. We never showed any actual patients in any of the video. But what I found was particularly interesting is the willingness to share their experiences. And it was very gripping. It's been very emotional, even from me, who I don't work in the hospital. I work in a corporate building, and seeing what they're going through was a very emotional experience, even for me, as kind of an outsider looking in. But it was just the appetite from news media for this type of content was just incredible, and it was different than anything. I've been doing this a long time. This is this kind of emotion was different than anything I've experienced previously.
Yeah, thank you. And can you just give us a sense, before we go back to Elyse, of the size of your system, how big you are in terms of employment, all of that, both raw numbers, and put it in context for New York State, please, Terry.
Sure. So Northwell Health consists of 23 hospitals as well as 800 outpatient facilities. We have facilities within the city of New York, on Long Island, which is where we are now, Westchester County. And we were at the epicenter of this pandemic. And to date, we have treated more COVID patients than any other health system in the country. We have treated more than 41,000 COVID patients, including nearly 13,500 hospitalized patients. So this is this has stressed our hospitals. It's stressed caregivers like Elyse and others to the max. This is a once in a generation crisis that we're experiencing. So again, the ability of those frontline caregivers to withstand that kind of pressure, the emotion that the heartbreak that they're seeing on a day-to-day basis, it's so laudatory. I can't begin to tell you how pride, the amount of pride that they've brought to the whole organization.
And what are the things that people need to understand about the American healthcare system, Terry, that America, which always is so proud of everything that we do in terms of healthcare, how did we end up in this state where we're still, the epicenter of the epicenter globally?
Well, again, I think there's this descended on us very quickly. There's been in recent weeks. There's been a lot of speculation about people posing why didn't we shut down earlier? We could have saved X number of lives if we had shut down the economy a week or two earlier. That we can all speculate, but what ended up happening is it just came upon us so suddenly. I mean, we went from having, I think we had our first confirmed case, I think the first week of March, maybe it was March 7th or 8th. And then it just, the trajectory from there was just incredible. I don't even think we had our first hospitalized patient until March 13th or 14th. And it went from less than 50 patients. And we reached our peak on April 7th with nearly 3,500 hospitalized patients in the span of a month. So that spike was just, and I don't think anybody saw that coming so quickly. We were all prepared for it. We knew there was this risk from the beginning. Northwell has a very robust emergency management plan. So when word of this virus first came out of Wuhan, we started putting in place our emergency response plans. Our caregivers were put on alert to start questioning patients as they came into our facilities. Have you traveled? What's been your travel history? Do you have any symptoms? So we were on guard for this. But again, what ended up happening with that communal spread is just happened so quickly and so rapidly that we were certainly over the fact that we were able to hold the line like we did, that our caregivers rose to the occasion is just astounding, frankly.
Yeah, it really is. Let's look at some of the comments coming in. Barbara says, Elyse, thank you for all you do. Elyse will be featured on a special Healthcare Heroes special airing this Monday, Memorial Day, on WNBC4 at 7 p.m. Oh, that's awesome. That's great. What will you be talking about? And let's see if we can steal some thunder from Channel 4.
So it was kind of throughout this whole thing, I've been video blogging my experience. I like to take pictures, I like to take videos. And then when I was asked, the videos brought a lot of happiness to what we were doing. People wanted to talk, people wanted to share their experiences. We worked together. It made us get dressed and put on makeup for a day, and that actually brought life to us. So I think the video blogs actually helped us. So some of the things on News 4 is going to be the video blogs that I was doing, as well as some of the experiences that we've been going throughout the last 2 months. We were definitely working in critical care in the medical ICU, because these are primarily medical intensive care patients that we're taking care of we were the first. We were the first to start, and we will be the first to end this COVID war. And we've learned a lot. We've grown a lot. We've created so many bonds throughout the whole hospital with different disciplines. We realized that we're all one. Everybody was in a shield and a mask, a shield, mask, everything, and everybody was uniform and one. And it was a beautiful experience as well as frightening and scary.
I just can't imagine, Elyse. We want everybody to follow Elyse on Instagram. She's Elyse_Isopo on IG, and please follow Northwell News. That's Terry's account, and that's on Twitter. So let's look at some of the comments. Here's Chris says, nurses are the lifeblood of healthcare. We can't do enough for them to celebrate all they do to heal. Elyse, how has the staff been since we surpassed the peak?
So I think the staff has been where we can't believe it's happening. We were in it, and I can't believe it was 2 months. It feels like a lifetime. The last 2 months we've been doing this and battling this. I think people are finally getting the reprieve that they need. The staff we've been trying to relieve people, to give people days off and swap people out, because now is time, since things are getting better and we're closing intensive care units slowly, and it's a wonderful experience closing and moving patients to different locations to be able to give people days off, the well-needed days off, trying to give people, a week off at a time or a day off, just to be able to take a deep breath and think back of everything we've experienced. I don't think we've truly felt everything that we've gone through. I keep saying, everybody's saying about post-traumatic stress after this. I don't think any of us, or some of us are there yet, but I know for myself, I'm still numb to it. I haven't thought through everything that we've gone through.
Yeah,
I do know we don't sleep well at night. All you do is think about everything that's going on at the hospital, things that you could do better, things that we can help. You want to be there because you want to help everybody else.
I truly am so grateful and listening to you, and thank you, Chris, for your question. I think one of the things that people don't understand is it's hard to get PTSD if you're still in the traumatic phase, right? Like you're still living it. You're not post-trauma yet, and that's what you're experiencing. And so many people. Let's look at some of the other comments that have been coming in. Redan, thanks everyone for the comments about his mother's who passed. If you missed that, she served for 50 years, folks, and thank you. And he says, I continue to pray for all on the front lines, as do we all. Ashok was watching in Kerala in India. Today happens to be the first death anniversary of the nurse Sree, who lost her life last year during the Nipah virus attack in Kerala in southern India. Remembering all the nurses and paramedical staff and doctors now. So that's a term that they use, their paramedical staff. I think that's really a good way to think about it. Redan says, as a family member of nurses and other healthcare workers, I have long had great respect for all who work on those capacities. Awesome. Thank you very much. Let's see who else is here. My father has joined us. He's watching in Kerala, India. Hi, Dad. Great to have you and my mom here. We're so sad that we can't be with you in person, but we can talk this way. We also have Jitu Bai, who's watching. And here is a comment from Sai. I knew how much pain during this pandemic for all nurses, doctors, and all healthcare workers to manage family and at the hospital. Really appreciate your efforts. And that brings me to Elyse with a question about how are you managing your own family? I know they're quiet right now downstairs, but there's remote learning and everything else. And even if we wish it was different, we know moms take the load in the family. So can you talk about that?
Absolutely. So I've been fortunate enough. My husband does work in healthcare as well, but he works in sales. So he's been not able to go to work, which is a huge help for me. Being that me and my husband going to work, our primary caregiver is my parents, who both ended up with COVID-19. So we have been quarantined from them for a very long time. It's over 2 months, because I personally quarantined myself from my parents 2 weeks before all of this even happened, knowing that working in critical care, I would be the first to see patients, and patients that we didn't know possibly had it. So I was trying to quarantine myself from my parents 2 weeks even before everything in the pandemic really got out there. So I did not give it to my parents, thankfully, but my parents ended up getting it. We obviously don't know how anybody really gets it, or where, or supermarkets or friends. But I thankfully have not. So that was very taxing on me, trying to take care of my dad that was in the hospital for 2 weeks while I was working on the front lines. I was fortunate enough to be in the same hospital with him, thank God, so I was able to be there and help manage the care. But that being said, I lost all my caregiving for my children. My husband stayed home and did his best to homeschool. I will say he has tremendously stepped it up. I would come home to cook dinners and everything was done in the house. The kids are kind of self-schooling themselves, and I'm fortunate enough to have an amazing school district. So the teachers, and a shout out to all the teachers at the school district where my kids go, because they, both the elementary school and the high school where my kids are, sent food to the hospital where I work, sent their love, and have been giving my kids extra special care, knowing that they don't have the support and help at home.
Oh, thank you. And that's great to know. And so a big shout out also to teachers. I think, Terry, it would be fair to say that people have suddenly woken up to the value of these two professions, nursing and teaching. You, of course, are in the industry, so you know it. But can you reflect on that? Like, how has this been embodied to you in the interest in nurses and nursing and all of that that's happening, Terry?
The outpouring of support has been really incredible. I mean, we've had restaurant owners just delivering food to our staff on the front lines on basically a daily basis, all free, of course. And again, you're all familiar with the clap outs that occur every evening at 7 o'clock. Again, I think that receiving that type of recognition and that reinforcement that everybody, that we're behind you on a daily basis has gone a long way toward trying to keep the morale of those employees. And it's something that as an organization, I mean, healthcare employees have always been, I think nurses in particular have always been the most well-respected profession that there is. And certainly this has solidified it for a lifetime. It's just, again, not to overlook physicians, but I think especially the nurses, what they're doing for those, as Elyse mentioned earlier, for those at the end of life and connecting them with family members is just so inspirational and so emotional.
Thank you, Terry. I will just say that the show has been on the air for 71 straight days because we've been on 71 days of lockdown. And I have been looking to get nurses on the show. We've had dozens of doctors, but just the way the American system is in terms of hospitals, having time, these nurses have been so busy in many ways. And there are fewer nurses in kind of like private practice so that they can, on their own decide to go on a show like this. It's been very interesting to see. So we're very grateful to Northwell for bringing Elyse, and for Elyse for giving us her time. She has to go to work today, don't you, Elyse?
I do. But I'm going in the afternoon. Today's a day off, so I'll go do more just to go help or administrative stuff, things like that.
Wait. Time out. It's a day off and you're just going to go in? Terry, what is going on here?
That is dedication.
That's where we belong. But it definitely is getting slowly better every day. I don't have to quite go in as much. I do a lot of clinical, and my clinicals are usually Monday, Tuesday, Wednesday, or there's 3 days of clinical, and then there's extra days I go in to help move patients to different ICUs, to help my staff, to relieve staff, just to be there as an extra support or an extra pair of hands, because you can't have enough. But definitely it's tremendously better now that I don't feel as much need to be there every single day.
All right. Well,
I think it's worth noting too, though, that even though there's been a significant decline in the number of patients in our hospitals, we still have about nearly 900 patients in our hospitals. At North Shore University Hospital, where Elyse works, I think there's like 170 or 160, something like that. So they're still busy, and there has been this change where many more patients, non-COVID patients, are coming in, but the strain on the frontline caregivers has not evaporated to any great extent, and they're still feeling that that pain and suffering of the patients and their families and loved ones. So again, the mere fact that Elyse is on her day off is going in is a testament to that type of commitment on the part of the employees.
And also doing this show when she could be just taking a nap. So thank you.
That's okay.
That too.
I do want to add to that. What Terry said was 100% that please continue to social distance, because even though we had 9 COVID ICUs, and now we're down to 4 COVID ICUs, but our non-COVID ICUs now are being taxed greatly. So we're feeling the strain between COVID ICUs and non-COVID ICUs, which is tremendous, because now we're going between, and the people that are coming in sick for the non-COVID ICUs are new patients coming in, but they're also the patients that have been positive for COVID and now transferred to non-COVID. So we're still being taxed greatly in all the ICUs and all the regular floors, because there's so many people that are still critically ill and sick, and that hasn't changed. The amount of patients coming in with COVID to the hospital has changed. That's significantly better. We feel a break from that, but the amount of patients hasn't changed. It's just where they're allotted has.
No, thank you, Terry. Go ahead.
Yeah, the one thing I wanted to add too, and to a shout out to all those caregivers who are working in nursing homes, the home care nurses who are going out and checking on patients in their homes. That's a very risky. Those are very high risk jobs as well. And again, their level of commitment, their courage needs to be applauded as well, because we all read about the large number of nursing home patients who have passed away. So that certainly has been a lot of heartbreak in the nursing homes. We happen to operate 3 of them, but again, that all across the state, I think there's been 5,000 some odd deaths in nursing homes alone. And again, their level of dedication has been incredible as well. And then again, the home care nurses, often overlooked here, going into people's homes. Every time they go into a home, they have to put on PPE. Every time they come out, they have to take it off, make sure they don't expose themselves. They typically visit 7 or 8 or 9 patients a day. So that is again a very great level of commitment on their part.
Yeah, absolutely. We just want to get through to some of the comments and questions coming in, folks. Please tell us where you're watching from. Please say hello to Elyse, our hero nurse who's with us. And we want to also make sure that if you have any questions, we can get them answered. I want to do a shout out to our producers, Rose Horowitz and Vandana Menon. And Rose is on Twitter, Rose Horowitz 31, and Vandana is Vandana_Menon. So thank you both. They've been with me, folks, for 71 straight days producing the show. No weekends, nothing. But what we do is nothing compared to what all these great heroes are doing. And we're so grateful. Here are some comments. Mr. Singh says, nurses are the backbone of a hospital. Sai says, wash hands, wash hands, wash hands. He's making sure that maybe he could be your spokesperson, Elyse, just saying that. And look at Jitu's quote, beautiful, nurses are angels of God. And that is really nice. Nick Balaban says, so hard to stay positive and not get swallowed up in rage over bad leadership and mismanagement. That being said, we must love. So I like that. He's angry and positive at the same time. And I'm sure, Elyse, in your own work, as you see these patients coming in, as you see, you must be frustrated in part, but you have to keep that optimism up. So we have a question for you from a doctor who's watching in Germany. Dr. Atagang, Bernadette Atagang was my guest on a show we had a few weeks ago. And by the way, that was at night in New York. She got off the air at 2 a.m. in Germany. And so how kind was she for us? But she says, greetings, Elyse. How do you feel mentally when you see people behave irresponsibly regarding stay home?
So I didn't realize how bad I felt about that until I went to a family event, and I'm not going to mention what it was. And I noticed when I went there, and I wasn't going to go we were social distancing. It happened to be a loved one's birthday. So, those parades are happening. So we bought a cake. We were going outside just to socially distance and hand the cake and just show our faces to our loved one. And when I walked in, there was a massive amount of people hanging out in one area in the living room inside, I think I lost my mind. And I'm very positive, happy, and people will tell you I don't scream, I don't yell. It's not my personality. But I was so upset when I saw it. I was so taken back. I actually said, if you only knew what I see every day, I should show you the pictures at what we're going through every day. And I don't wish this disease upon anybody, but if you only knew what we see, it's not over yet. And my kids were they're like, Mom, stop. But I couldn't stop because it was so upsetting, because it's the only way we were able to get where we are right now is social distancing, good hand washing. And I feel like our PPE is obviously working, because most of the staff and myself that have not been sick, thank God, have negative antibodies as well. We were a little taken back by having negative antibodies. We were hoping we were slowly getting inoculated to the virus by being in it constantly. But obviously what we're doing is working, and what we're doing is good hand washing and PPE.
And that social distancing. Thank you for sharing that. We know, Terry, that part of the problem that we are seeing in the world today, not just in America, but everywhere, is misinformation, disinformation, that is riling up people to not believe the news. And so you've seen, for example, that people are saying we overreacted as a society because look how few the deaths are. And by the way, when they say few, they mean 90,000 deaths. Like, that itself is a whole other conversation. But how do you disprove that, right? Like, the reason we took all this economic pain and social and other pain, Terry, is so that we can be in this position. We wish the numbers were even lower, but to the opponents of all of this, to them, this is proof that they didn't need to do it in the first place. So this is not a political conversation, but can you address that, please, Terry?
Yeah, unfortunately, it has become somewhat of a political situation, and with the push towards reopening the economy. But when you see these people, these people have clearly not been personally affected by those who have died during this crisis, who have gotten sick during this crisis. And to Elyse's point, it's really disrespectful. I find it for those who continue to flaunt it, who dismiss it. The numbers speak for themselves. No pandemic, epidemic in recent history has had the death toll that the coronavirus has had on this society. Not since the AIDS epidemic from the 1980s have we seen this kind of loss of life. So to dismiss it so arbitrarily and call it an overreaction, if anything, again, the statistics show that we probably didn't act soon enough. If we acted, there was a study out today that if we acted a week earlier, we could have cut the death toll by half. So again, to dismiss it and diminish the impact that it's had on millions of people, millions of families, it's insulting, frankly.
I completely agree. Let's go to some of the comments here. And Dr. Atagang, again, watching from Hamburg, says, thank you for your service and leadership, Elyse. And my father, who's watching in Kerala, says, did someone mention Florence Nightingale today? She's worshipped as the lady with the lamp. I don't know, is Florence Nightingale someone that Americans are really aware of, or is it something we read in maybe some fifth grade book? So as a nurse, tell us how is she seen as kind of a patron saint, maybe? Could you talk about that, please?
Absolutely. So Florence Nightingale is our leader. And it was her 200th birthday, Nurses Week, 2 weeks ago. And we definitely salute her. And she is definitely a patron saint, as you call it. She is, her whole thing was infection control and hand washing. And it's so ironic, 200 years later, and that's what works. That's what works with this pandemic. So she is definitely someone we talk about. She's definitely someone, as nurses, we look up to and we learn about, because she said it all. And 200 years later, we're all thinking the same thing. Hand washing and infection control is essential.
Yeah, that's really important. And I'm sorry to say I missed the 200th anniversary. That tells you how much is going on, right? Like we are not able to pay attention to all the news, and that's so we salute Florence Nightingale. Dr. Atagang says, paradox of prevention. Measures function so well that people turn to think they were not needed. That is stunning in all of this. Elyse and Terry, I'll ask you the same question. The value of science, the value of medicine, the value of taking expertise seriously has been highlighted to me on a global scale. How do we teach people that these things matter? It is not a feeling, a gut feeling. It is not instinct that we need. We need sound science so that we are very careful in how we behave going forward. And this may not be the last pandemic. In fact, everything tells us there could be more to come, and there will be more to come. So Terry first, and then to Elyse on this particular question.
Yeah, so there's a lot of lessons learned here, and I think what we're doing as an organization, as I mentioned before, we've treated more than 40,000 patients across our health system. So we're going beyond just what we're developing is a longitudinal study where we are going to be tracking these individuals and staying in touch with them to find out in the next month or two, are they developing any other kind of illnesses that will tell us more about how this virus progresses, how it does impact the body. And we all know about the predictions of COVID resurfacing in the fall. So we're in the very early stages of really understanding this virus, knowing how it progresses, and obviously the how it spread. I mean, there's every day we're learning more about. Today there was a study about while the virus does transmit. There are traces of the virus on objects, surfaces. It's not as easily transmittable as we first thought. So we are learning more as we go along. But again, I think the more we focus on the science, the less we talk about the politics of this, the less we get off on conversations about hydroxy. I think the better. We have to rely on the science. Getting into the politics just takes us totally off track. A lot of important clinical trials going on right now. With Northwell alone, we have 7 treatment trials that are in place involving more than 1,000 patients. There's a lot to be learned there about if this virus does resurface, how can we treat people most effectively.
Sorry, I was trying to play a video that Elyse was on, so let's just show it here on my phone. That's Elyse with Chris Cuomo on CNN. Nurse practitioner. In 20 years, I've never seen it this bad. What is it like, Elyse? I think it'd be fair to say most nurses are private people who only want to do their work and do that. You have found a calling to also share what you're doing, just as we see many doctors sharing, and I wish and hope you will inspire more nurses to be able to share like you're doing. What is it that has enabled you to be able to be such a clear communicator and helping so many people by doing shows like this, or of course CNN and Channel 4 on Monday?
So I will thank Terry for that as well. When this first began, I'm always a sharer. I like people. I'm a people person. I like to talk. I like to socialize, but not at this trajectory and not globally at all. We are private people. Being called a hero definitely makes me feel uncomfortable. It's just because I feel like this is what I do and this is what I do every day. And my 9-year-old actually put it perfectly when this all began and things started saying, healthcare heroes. And my 9-year-old said to me, "But Mom, you do this every day. Why now are people acknowledging it?" And we know it's at such a different level. And I just do my job. This is my job. This is my calling. This is where I belong. I want to help people. The more people I can help, the better. The more people I could save. If I was a hero saves everyone. And obviously we can't do that. And my whole motto the whole time in this whole going through this whole thing is, if I can't save a life, I can make a peaceful death. And I've said that my whole career, working critical care. If I can't save a life, at least I can make the death peaceful, pain-free, and as beautiful for a family and as well as the patient as I can, because that's just what I do in critical care. So I feel that it's a little weird and uncomfortable. But when people ask me to do these things, I'm a yes person. I like to say yes. I like to help others. I'm a selfless, that's just me. I'm selfless. I'd rather help everybody else. And if this is going to help one person or anybody out there by speaking out, then that's what we do.
All right. Thank you so much. I can't keep saying thank you, but I will, because that's the least we can say to you. And not just you, through Elyse, we're saying thank you to everyone. Chester says, are we prepared if another surge arises? So let me ask Terry, from the business side of the hospital, are we ready? Because we fear that there's going to be another wave thanks to all this easing of social distancing that aren't following the government's own guidelines, and the government's the one opening. So Terry, to you first on the business side.
Yeah, so the one of the interesting things that came about is that once we realized the extent of what the surge was going to be, we created 200 additional beds a day over the course of about a week and a half, about 10 days. Northwell typically has 4,000 acute care beds. We ended up creating 2,000 additional acute care beds. Fortunately, we did not need them all, but we probably ended up hitting a peak at about 5,400 of those beds being full. So we did things like we had beds that we were putting in conference rooms, in lobbies. The fact that we were not doing elective surgeries, we were putting beds in procedure rooms, in ORs, endoscopy rooms. Many of our hospitals erected tents. So many of those tents are still up. The feeling is that, again, the uncertainty about if this virus does resurface, how bad is it going to be? So we are much better prepared now than we were back in early March when this first took hold. And again, there is that excess capacity that's there if we need it right now.
Look, I'm so glad to hear that. Sai is watching, and he says, all the blessings from all the gods to your family. I think that's beautiful. Dr. Atagang says, we have to fight the infodemic and occupy the space with data and science. I think that's really important. And my wife is watching. Rupa says, wow, such an amazing thought. Save a life, if not, help it be a peaceful death. And we're just getting so many comments from all over the world here. Daniela is saying, watching from New York City, thanks for bringing the segment to us, Sree, Elyse, and Terry. Nurse diaries are a courageous and creative way of informing us tucked away safely at home about frontline efforts. Thanks to all registered nurses, healthcare workers, and hospital administrators at Northwell. So thank you. But this is a question that I'm sure some of our audience watching all over the world, at least, may not be sure. What is a registered nurse, a nurse practitioner? Because these terms are not the same globally. So we'll go to you on that.
So I will say I am a nurse, and I will always be a nurse. So in order to be a nurse practitioner, you get a master's degree in nursing. I'm able to practice as a isolated practitioner. I can write prescriptions, I can place orders. But the good thing about being a nurse practitioner is I'm always a nurse, and I was a nurse in the ICU for many years. So I can do things as a nurse, and I also can, right now, I do things as a nurse practitioner. So I do take care of patients from the medical perspective, writing orders, doing treatments, putting in lines in the ICU, central lines, and all these people are critically ill, and prescribing the treatment and diagnosis. But also I am at the bedside with my colleagues, constantly turning and cleaning and anything that's needed. We're all in this together. And you've seen that constantly. So the difference is that it's a master's degree and you're able to practice independently as a nurse practitioner. But once a nurse practitioner, you always keep your nursing license. You can't be a nurse practitioner without being a nurse.
Okay, great to know. Thank you. We have so many questions and comments. We have you only for another 5 minutes, so we're going to do quick questions and quick answers. Terry, here's a comment from Jason who says, it seems Northwell is in the news more than other organizations. Is Northwell more open to sharing information than about the pandemic? If so, what does that philosophy come from? And so, is it true? I'm sure Terry will tell you it's true, but what's the sense you have there, Terry?
Yeah, so we've tried to be transparent with the news media about what's going on. There's some organizations that have been. I'll give you an example. So we often get questions about how many patients have died across our health system, and sadly, there's been about 2,500 patients who have passed away, and that's an astounding number. We've discharged successfully more than 11,000 patients. But again, we're seeing, as do some quick math, we're seeing a mortality of about 20%, 19%. So we've shared that information, and at times when I have done that, I found myself to be the only one out there sharing that information. So, but I think doing that has developed really solid relationships with news organizations. They realize they can trust us, that we're being straight with them. And again, we've become kind of the go-to organization from a healthcare standpoint with the news media who are looking to connect with our caregivers. And again, the mere fact that we're Elyse and several dozen others have been willing to share their experiences on the front lines. As I said before, the news media has been very appreciative of that, and again, it's really helped put in focus what is happening right now.
So I want everyone who works at another hospital system to learn from this and make sure that they too are sharing and transparent. That's the only thing that will counter the fake information that's out there. And people on the trolls side of this, they will jump on anything that seems unclear and infect it in that terrible way, as we know. So again, we just have a couple of minutes. We want to read a couple of questions here. Do we have to live with COVID-19 as we have with HIV and hepatitis? The trends show this. Won't we take at least another year to develop a vaccine? And then I'd say to Elyse that my worry is that the issue of vaccines has been so contaminated in America by candidate Trump, by Robert F. Kennedy Jr., by Jenny McCarthy, all of these people, that there will be millions of Americans, if there is a free vaccine that they can take today that will save their lives, will not take it. And then that doesn't help all of us, or any of us, at least.
I couldn't agree more. There's so many vaccines that we know that save lives that people do not take, do not give their children because of side effects. So we focusing on this vaccine, but are people really going to use it? How many people are really going to use it? I don't think COVID-19 is going away. I think we know we have to live with this now, but I think we know how to live with it better. And as time goes on, we're learning more and more about it. And that's one thing, being a frontline staff, I've watched, and never in my life, we heard about the Spanish flu, and we heard about how you treated all these different things, pandemics in the past, but we never had to live with something and watching things transfold and unfold, that something worked, and now the next day the protocol doesn't work, and then a week later it's a different protocol. And it was something amazing to experience and learn and watch transpire over time. We put protocols in place, and then we had to unfold protocols because we now know they don't work. And over time, the more time that passes, we are going to find something, a vaccine. We are going to find medications that work, and we just need the time to be able to do it. And I think now is the time that we've slowed the curve, that we've had social distances, that we have this social apartness is going to help us for our future to get better, because it's not going away.
Thank you. Sai says, is asking about India in respect to the vaccine, since India's cases have increased rapidly. So let me ask Terry, as the person who kind of has a 30,000-foot level view, what is your advice to countries or even states in America about how to handle the second wave or the current wave as it increases all over the world. So Terry, your thoughts?
Yeah, I think we still have to be, as the economies reopen, we still have to remain cautious, have to be very, again, maintain the social distancing, continue to be very vigilant when it comes to hand hygiene, group gatherings. I know everybody's very eager to resume life as we know it, but this has changed us, and this is going to change society, and we are not going to revert back, certainly not in the near term, to how life was before. So again, I think we're going to have to get used to viewing sporting events, watching it on television, not being able to go there in person. Unfortunately, and I'm a huge sports fan, but I just don't see that happening anytime soon.
Yeah, it's really, really sad. We're out of time here. I want to read Radhyan's quote. There's so much to learn from public reaction to the pandemic of 1918. There were public gatherings in defiance of scientific and medical advice, which resulted in a resurgence of cases. And that's what's happening now. It is happening today all over the country. And for those of us in America, we're experiencing Memorial Day weekend, which is a traditional time to go out and celebrate the outdoors, and people are going to do that. But please stay careful, be careful as you do this. So just as we want to give each of our guests a moment to reflect and give us a final thought before I thank them. And then I'm going to ask Elyse to do something I've never asked my guests because I let them run after this, but I'm going to ask you to stay after I'm done with the show so I can just thank you personally and with Terry to just say hello. So let's go to Terry, a couple of final thoughts from your side, and then we'll go to Elyse.
So one of the things, just a final thought, we're in the process now, Northwell, in conducting a huge amount of antibody testing. What antibody testing allows us to determine is the prevalence of the how prevalent the COVID-19 is in the various communities that we serve throughout the metropolitan area. We haven't had an initiative the last couple of weeks where we're doing testing, both diagnostic antibody testing in low-income churches throughout the region. And what we're seeing is about 3 out of every 10 people in those communities are testing positive for COVID antibodies. So again, a big focus moving forward is to try and address that in Black, Hispanic, Asian communities, and which is going to really help us if there is a resurgence, in trying to keep people safe.
Thank you. Can you just, because the name Northwell is of a group, right? So of a bunch of different hospitals. What are some of the biggest hospitals so that names people may recognize?
So our flagship hospitals in Manhattan, Lenox Hill Hospital in Manhattan, North Shore University Hospital, which is in Nassau County, Long Island Jewish Medical Center in Queens. It's on the Queens-Nassau border. We have Southside Hospital in Bayshore, and Staten Island University Hospital. Wow,
those are all iconic for folks from outside New York State. These are iconic, legendary hospitals that have had millions and millions of patients over the years. Radhyan says, "Stay strong and blessings to you all." Ashok says, "Thank you for the wonderful session, really informative." So let's go to Elyse. Elyse, thank you for being here. She is Elyse_Isopo on Instagram, and by the way, Terry is at Northwell News. So Elyse, your final thoughts for now.
My final thoughts are just to thank you for having me, and thank you for putting this out there. And thank you to the community and all the people that have helped us and supported us, and not only given us things, but the wishes and the prayers, and they're working and they're helping. And I just want to thank everybody for the support.
And I want to show you that my father just tweeted, I just heard from my global show that Florence Nightingale discovered 200 years ago, hand washing was the best way to protect ourselves against virus infection. Medical science has advanced so much, but what the lady with the lamp taught us is still valid. So there you go. From your mouth, it went to India, and my dad it at Sreenev on Twitter. So before you go, I just wanted to show you, you folks are in Long Island. I picked up my laptop. I just want to show you New York City and show you how empty New York is. We're on the Upper West Side of Manhattan folks. And in the distance, you can see Midtown Manhattan. Over there, you can see New Jersey. That is where Terry lives, but he works in Long Island, which is in the other direction over there. But look at the streets, Terry. Look at the streets,
So,
how empty it is. That's a subway station with nobody going in or out. And you know, Terry, that anytime there would be hundreds of people every minute kind of going in and out of a place like that.
Crazy, unbelievable.
Yeah, and it's very, very, very sad. So I'm going to say thank you to our guests, and but I want them to stay in the green room so I can come back and say hello and thank you so much publicly to Elyse. You are a hero, and on behalf of all of us who are getting to stay indoors and complain about the kids making too much noise, complaining that we don't have enough zucchini and things like that, while you go and do the work and save lives. We're so, so grateful. And Terry, thank you to you and your team for making it possible for folks to hear from people like Elyse, and also running the system, because after all, it is an industry, it is a business, and making sure that the resources are there for everyone. So thank you to you both.
Thanks, Sree. Thanks for having us.
Thank you. And we will be just saying goodbye for just a quick second. Thank you, everybody, for watching. We do this every day. This was episode 71. Episode 72 will be tomorrow. So please join us. If you have any feedback, Sree@Sree.net, SREE@SREE.net. We're looking for themes, guests, topics, and we are looking, as always, for sponsors. So if you would like to sponsor this, please let us know. We'd love to have you. And then a reminder that my Fundamentals of Social Media course is going live in June. It is free for anybody in the world to take advantage of, and we hope you will. You just go to mrac.co/social, mrac.co/social. It's a free course, free certification, Fundamentals of Social Media. We want everyone to benefit from this. We've had more than 3,000 people sign up already. It's free. It's about 2 hours of content. Launches in June. Fundamentals of Social Media, muckrack.co/social. And with that, I want to thank you all for being here. Thank you for your support of this program. Many of you have told me this is a lifeline. Many of you have said this is uplifting, but I want to tell you that I'm the one uplifted by this show, by your presence, by your audience, and your generous sharing of this. So thank you very much. We'll see you again. Bye-bye, everybody. Thank you. Thank you. Thank you.